Hello, my name is Michael Wagner. I am the Assistant Vice President for Quality at Beacon Health Options, YourCare's behavioral health partner. Today we'll be talking about Beacon Health Options PCP Toolkit, a resource for identification, screening, treatment, and referral for members with behavioral health conditions. As we go through the slide deck in this brief webinar, I would encourage you also to explore Beacon Health Options PCP Toolkit. I will be bringing up the links in a few moments so you can see how to navigate to that page. To give you a brief background about the toolkit, the framework is that Beacon is committed to leading the integration of medical and behavioral health services to improve patient outcomes. The idea is that oftentimes primary care practitioners are the first line of defense, so to speak, for behavioral health issues. Primary care physicians play a critical role in the proper identification and treatment of behavioral health conditions. And a critical aspect of this treatment is also to consider when it's appropriate to make referrals to a behavioral health specialist. As a collaborative healthcare partner with YourCare, Beacon supports PCPs through information sharing and support so that they have the tools and resources they need to successfully treat patients. Beacon's toolkit has been developed to support our ongoing collaborative initiatives with primary care practices. A little bit about the history of the toolkit. The PCP toolkit development process incorporated input from both PCPs as well as behavioral health physicians. We conducted research from primary source information as well as consultation with primary care practices to identify questions such as who is presenting to their practice with behavioral health conditions? What conditions are they seeing most frequently? What do they do currently to treat those behavioral health conditions? When do they make a consideration for a referral as part of that treatment? And what additional resources would be helpful to help in decision support for treatment for those patients? We also conducted secondary research around existing resources for behavioral health conditions. And the idea behind this is that there are many existing tools available in the public domain for the treatment of behavioral health conditions in primary care settings. And Beacon's attempt was to cull through that plethora of resources to find what seemed to be very easy to use resources that are accessible, that can be used as member-facing materials as well, and really can help with quick decision making around the treatment for those conditions. We conducted a rigorous review of material within the toolkit, and this is not just a point-in-time review, but an ongoing review. So looking, for example, at clinical practice guidelines to make sure that the resources that we put on the toolkit are indeed the latest resources, and I'll bring an example up as we move forward in this presentation. Moving forward with the toolkit, we consider this to be essentially a living document. So the resources will change as the research or literature changes. So the information that you'll see today may be somewhat different from the information you'll see 6 months from now because the research or the materials have been modified and improved. There are several critical components of the toolkit, including member-facing resources, so fact sheets, as well as self-management tools and interactive tools. There are also diagnostic references, for example, the American Psychiatric Association Clinical Practice Guideline, as well as clinical practice guideline materials that are intended for the behavioral health conditions in primary care settings, as well as information about DSM-4 and 5 diagnostic criteria. We also have information and actual screening tools, for example, the PHQ-9 and the PHQ-2, which is an initial screening that would prompt one to conduct the PHQ-9, as well as a global anxiety scale, the GAD-7, and other tools and resources. We also include prescribing references, and these are intended to be generic in that they would not necessarily be aligned one-to-one with the health plan formulary, but rather are intended to be global resources to inform decision-making around prescription practices. Another component of the toolkit is that we build into the toolkit the availability of psychiatrists to provide consultation to physicians and primary care practitioners who may be wanting some additional help by phone. So at this point, I'd like to encourage you to explore the toolkit itself as we move forward in this presentation. I'll continue to talk about some of the tools and resources and give you some examples as well. There are a few ways to navigate onto the page. You can go to beaconhealthstrategies.com and click on the Providers tab, and then that will drop down to a quick link to the PCP toolkit. Similarly, there's an option when you go to the beaconhealthstrategies.com website, you would float your cursor over the Provider tab, and that would open up the option to go to the hyperlink to the toolkit itself. So the next few slides, I'll show some screenshots of the toolkit itself and give you a sense for the way that we've structured the toolkit, and it moves forward to address a number of behavioral health conditions, which you can see on the left-hand side of the screen. So it includes ADHD, alcohol and substance abuse, anxiety, depression, etc. When you navigate to the PCP toolkit, the opening page is this page that you see before you now, which is an introductory page that includes a summary of information about the importance of sharing information between or among providers, whether it's primary care to behavioral health, among primary care and specialist practitioners, as well as among behavioral health and substance use practitioners. I'm moving forward with an example with a screenshot when you link onto the Depression tab. And in this tab, I'd like to just give you an orientation to the structure for this page, which is carried through in the other pages as well for each condition. What you'll see is there's an introductory statement at the top of the page. Then there are guidelines for diagnosis and treatment. There are member materials, and the Depression tab includes a number of types of member materials, both static documents, which are, for example, printable brochures, and then there are some interactive tools as well, which I'll demonstrate. And then finally, at the bottom of the screen, we include information about screening tools. So here we have, for example, a depression screening program description, a PCP depression assessment tool, as well as the PHQ-9 tool itself. So again, the structure for this depression page is that we include guidelines for diagnosis and treatment, member materials, and screening tools. As we link onto the guideline tool, for example, on the depression page, it'll bring up the ICSI Adult Depression in Primary Care Guideline. And this is a document that's quite extensive. I believe it's around 200 pages. So we would not expect that an individual practitioner would necessarily look at the entire guideline, but it includes diagnostic decision support tools within the guidelines based on DSM-5 criteria. So that, in essence, functions as a shortcut to the entire guideline itself. On this page, you'll see an example of a member-facing tool, and this is a tracking tool that we've developed that is intended to be user-friendly in that the language is not too difficult or diagnostic, but really what it's intended to do is facilitate the discussion between the prescriber and the member. So there are pieces of information related to what to expect when you're being treated for depression, key points to remember in discussions with your provider about taking the antidepressant, as well as tracking tools. So there's information, for example, around listing healthcare providers, and this is intended to support continuity and coordination of care. There's also a section listing current medications, and that would support, for example, decision support and potential contraindications for different classes of medication. There's a section for other supports, so looking at natural community supports, friends, family, others who are important in the member's life who may be helpful in that person's recovery, as well as a section to identify activities to improve one's mood. And that gets at the idea of self-management. An example of some other materials that are on that page include brochures, so these are printable documents. Bulletins, so on the left-hand side you'll see what is a poster that can be printed, or if you are interested in receiving a copy of this poster, Beacon is happy to provide that to you as well. And then there's a section, for example, around depression recovery tips. In terms of the interactive tools, if you click on the link on the depression page to a member self-assessment, it brings the person to this depression screening quiz, which is a series of questions that are essentially the PHQ-9 that come up with a summary score about that person's level of depression and recommendations about next steps to get treatment. Again, continuing with the identification of materials. Here's an example of a provider-facing tool. So this might be used in a practice setting for the use of the PHQ-2. So on the left-hand side of the screen, the 2-question screen that you see before you is the PHQ-2. And a positive score in the PHQ-2 might prompt one then to complete the PHQ-9 assessment. There's also information about DSM-5 diagnostic criteria on the top right, as well as information about suicide risk assessment and using a mnemonic, the SAD person scale, as a way to conduct an assessment of suicide risk. There are also a number of depression screening tools that Beacon encourages or promotes. And the PHQ-2 or the PHQ-9 is endorsed by the National Quality Forum, and we believe that it is a very easy to use tool that can help a practitioner make quick decisions about treatment based on the level of severity of a person's presentation or issues with depression symptoms. So what I'd like to do next is go to the toolkit itself. And at this point, I'd encourage you again to explore the toolkit on your own, but I'll just show a quick demonstration of the navigation. So I floated to the Provider tab and down to the PCP Toolkit hyperlink. And there it brings us to that opening page. And as you scroll down, there is a summary, the case for addressing behavioral health issues in a primary care setting. I'll go quickly to the Depression tab. So on the left-hand side of the screen, you hit that link once, and it brings you to the depression information. So I'm linking to the primary care clinical practice guideline, which is from the Institute for Clinical Systems Improvement. And I'm going to scroll down quickly in that page just to show you what I was speaking to earlier in terms of the algorithm. So rather than read the entire guideline itself, a practitioner can use this algorithm to start making some quick decisions in terms of member safety. If the person is presenting as potentially unsafe, that of course prompts the practitioner to make different decisions about the next steps for immediacy of risk. I'll scroll back to the depression page and give an example of some of the member materials. So I had brought up a similar tool here, but what I'd like to show is the screen capture or the actual tool for you and your healthcare provider working together to treat depression. So I showed this on the screen capture, and I'm just going to scroll down, and it's just a printable document that you can use or give to the member to support some decisions around next steps for treatment. What I'd like to point out also is in some of the tabs by diagnostic area, we have a program description. And this program description is about best practices for screening. And I'll give an example for this, that we have the program description that includes the background and rationale and information about the importance of screening, information about the PHQ-2 and the PHQ-9 as endorsed by the National Quality Forum, and then there are hyperlinks to the tools themselves, as well as information about recommendations for the screening frequency. And then finally, there's information about the importance of screening for suicide as recommended by the U.S. Preventative Task Force. Now, scrolling back to that landing page for depression, I'll go to one other tab, which is for the alcohol and substance use conditions. And this includes, again, the structure for guidelines for diagnosis and treatment, member materials, as well as screening tools. And similar to the depression tab, we have a screening tool program description for comorbid mental health and substance use disorders. So there's the background, the rationale, etc. And as I scroll down, you'll be able to see that there are links to the audit tool, the CAGE aid tool, the CRAFT tool, as well as the PHQ tool as well. We'll scroll back to the landing page for the substance use disorder tab, and you can see that there are other tabs. So, for example, eating disorders, or if I go to postpartum depression, we made a determination for postpartum depression, for example, that the best resource is the primary source. So as I go to that hyperlink, you can see this is the Postpartum Support International, which includes some really great resources and links specific to the assessment and treatment of postpartum depression. And what I would encourage you to do as we finish this presentation is take a few moments to explore the toolkit. And if you have any questions, please feel free to contact Beacon, and we are happy to provide you with more information and resources. Thank you very much.